We had a patient who really struggled for 5 years with this mysterious illness. She's a highly educated professional, holds an advanced degree, and was in her business, has started her family, and all of a sudden started to get ill. And she went to see lots of doctors, very expensive, down to the Mayo Clinic. Very common when something gets mysterious that we're down to the Mayo Clinic. That's why about a third of our people have been to Mayo Clinic and still couldn't quite grab the answers. And 5 years into this program, her husband came up to her and said, I'm out. I'm done. No one knows what you have. I don't know if you're making it up. I don't know. I can't function like this. I'm sorry, but I'm leaving. I mean, she did what she had to do. She just moved forward. She's got 2 kids, so you got to deal with that. And now her husband's going, I can't do it. So she lost her family, kind of, or at least that was not how she expected to go. She's seeing her career slip away because she's missing work. She's going to her car to take 2 naps a day just to get through a work day. And then when she gets home, she can't really be the mom she wants to be. So this is a person, like I said, extremely well accomplished, highly educated before this all happened. And her story just kind of broke my heart because I'm going, okay, what happened? And she found a Lyme functional medicine person in the cities 3 years ago, diagnosed her with Lyme, and then started some stuff for her. And I just met her kind of out and about, and we started talking, and I said, well, how long have you been working on this? She said, 3 years. I said, well, how are you doing? That's a long time. She goes, is it a long time? I go, well, we tell people 12 to 18 months. You really should be quite good. Well, it's been 3 years. I said, okay, are you better? She goes, I'm worse than when I started. I said, well, maybe you need a second opinion. It's just that's a long time. Maybe you kind of need a second opinion. And I took a look at her protocol. She was taking 46 pills a day, which is somewhat common. You're on 12 or 15 different vitamins. A lot of times when you're sick, they start to pile up, and you're on 3 to 4, 6 a day of whatever. So it was 46 pills. And I looked at this and I said, of your protocol, 44 of the 46 pills are kind of just trying to help you keep it together. 2 pills a day, 2 vitamins a day are really, in my opinion, trying to move you forward from point A to point B. And I said, I think that's really a disproportionate amount of what you're doing. I'm okay. I tell people, we really want 80% of what you're doing to be moving you forward. And we want 20% to be helping you get by so you don't have to suffer. I used to say 100% at the root cause. That's a mistake an early doctor makes. 100% of the root cause means your people are miserable while you're going through the root cause. 80% means you're making progress, and the 20% helps people smooth it out. But she started working with us about 6 months ago. And I got to tell you, the last 3 months have been some of the best 3 months she's had in 10 years. And that's some pretty quick results, although she's had some things going for her. But the last appointments were these kind of boring appointments I'm talking about. How you doing? I'm doing good. What are you doing? I'm doing all this stuff with my family. I'm doing all these trips with my girls. My job, I haven't had to take a nap in a month. I just work the day. And then what do you do? Well, then I go home and I'm mom with my girls. And I go, well, good. Do you want to change anything? I'm like, not really. If it's going that good, my general rule is, let's be patient when it's going good. The better it's going, the more patient I am. The worse it's going, the more I want to fiddle and change and alter and do these things. But she's the patient that I think I saw her a couple weeks ago, and I'm going to see her again in a few weeks. That I just am thrilled for her ability to engage at her career, because she has career aspirations, and her ability to engage as a mom. Because it's been 10 years of her going, I can't do the things in life, I can't live the life I want to live because I don't have the health to do it. And so she's a patient we're getting good results with, that I'm excited for her to get all the way through. And then there's some other people too who have similar stories. Those are the stories that tend to get me, are the ones when I have career goals, I have family goals, I have these things, and they're not happening because I have this illness. Can you please help me regain, even the option of being able to work at my life? And that's really what we want to help people do, is regain their life, regain the health to at least engage in their life.
That's a beautiful story. Thank you.